I'm the author of the book Oxygen Therapies, and up to the present time I've been on about 750 radio and TV shows and speaking platforms trying to get the information out that you're about to hear on this tape, that there is a very highly effective form of medical treatment being practiced around the world, yet it's being completely ignored by the mainstream medical people in the United States. And I'm trying to tell people that this is available to them, and trying to get the establishment, so to speak, to incorporate it in our medical practices. My degree is in educational media and technology from the University of Massachusetts. I'm a journalist, and what qualifies me for doing this type of thing, like writing the book and giving these lectures and all, is that I have interviewed thousands of people that have been taking oxygen therapies, which is our subject tonight, and hundreds of doctors that use oxygen therapies daily in their medical practices.
Okay. Just, you can keep it here if you want to, between you and me here.
Okay.
So just speak to me. Okay, well, let's get right down to it. I mean, could you explain the basis of how oxygen therapies, or should I say ozone therapies, work on diseases like AIDS?
Well, medical ozone therapy is one of the many oxygen therapies. In my book, Oxygen Therapies, A New Way of Approaching Disease, I have talked about approximately 30 different ways to oxygenate the body, including such simple things as deep breathing. There is a way to introduce very active forms of oxygen into the body so that two main things happen. The first thing is that all the garbage, the pollution, all the environmental toxicity that has been collected in our bodies since we were young children, and even in our parents' bodies before us, all this is making our cells unable to function like they're supposed to. So what happens is the body is trying to remove this waste, but since there is so little actual available oxygen anymore in the atmosphere or in our food or in our water, because we've gotten so far away from nature, that what happens is our bodies are no longer able to remove the pollution, the toxicity, the waste products that are backing up in our systems. When you give the body enough oxygen, it can finally burn up this toxicity. If you were to blow on your hand, you see that your hand is warm. It's warm and it's wet. We're burning up. This is the process of life. We're like a candle that's trying to burn. But this candle called life can't burn very efficiently unless it has enough oxygen. Well, nobody on this planet has enough oxygen. I mean, we live, we get by, but everybody's getting sick and diseased, aging, dying long before they have to. If the oxygen is returned to the body starts to work efficiently again as it was designed to do, and then we get a very good elimination system that takes the toxicity and the pollution out. That's the first thing that the oxygen therapies do. The second thing that the oxygen therapies do is that all this garbage, this pollution, of course, will start making our cells diseased or feeble or weak or whatever, so that our cells are very low as far as energy quotient goes. They get it in a very low state. Well, in this state, viruses, bacteria, microbes, funguses, pathogens that cause all of our diseases are then able to move into the body, start growing very rapidly, and living off the garbage, the pollution, the toxicity, and the dying cells. It's just like if you're driving down the road and you see a dead animal that's been hit by a car. Well, it's being consumed by microbes, bacteria, vermin, etc. In the same way, our bodies, because we don't have enough oxygen, are becoming hosts for bacteria, viruses, funguses, and pathogens that don't belong in there, but because we have such a low oxygen condition, we have a lot of garbage for them to live off of. We're warm, we're wet, it's dark in there, it's a perfect environment for them to live in. But here's the key, the second key to oxygen therapies, and this is the main thing, is that most disease-causing microorganisms, bacteria, viruses, funguses, and pathogens, are anaerobic. Anaerobic means they cannot live in oxygen. So if you were to take a bacteria or a virus, let's say this is a bacteria, and you surround it with oxygen, if it's an anaerobic bacteria or virus, and you surround it with oxygen, it can't live in oxygen. What's going to happen to the bacteria, the virus? Let's say if it's a virus that causes herpes, hepatitis, maybe even AIDS. These viruses are mostly anaerobic. The vast majority of them are anaerobic, and if you surround them with oxygen, they die. They disappear. This is our immune system at work. That's the way our bodies are supposed to be functioning, but nobody has enough oxygen to do this anymore.
Now, okay, this is talking about oxygen therapies, and I know there's a therapy that's called ozone therapy. Now, what is the most common misunderstanding about the term ozone?
Okay, one of the many oxygen therapies is called medical ozone therapy. Everyone in this country, because of the media convention of calling smog ozone, which is a lie, in my opinion, everyone thinks that ozone must be smog or must be dirty or bad for us or something. But everyone also thinks, well, wait a minute, there's this good ozone somewhere too. So if you just think about the medical oxygen therapies as being the good ozone, then that's exactly what we're talking about. We're talking about a condition where you take pure medical oxygen, you hit it with something very energetic like an electrical field or the sun's light, turns the O2 oxygen into O3, making it a very active, very aggressive form of oxygen. This is pure oxygen, ozone. Medical oxygen is 98%. The pure ozone is about 2% of the mixture that's commonly being used. Doctors have been injecting this, infusing it, putting it into people's bodies in various ways for over 50 years, in hundreds of thousands of cases all over the world, without anyone being ever seriously injured from unless there was a misapplication. They didn't follow the protocols. So these protocols, for example, in one method of doing this, 5.5 million dosages of ozone were given to patients. The side effect rate they measured was 0.0007%. In other words, out of 5.5 million dosages, 32 people had any kind of a headache or a rash or a fever or a flu or something. Now compare and contrast this with prescription drugs in our country. In prescription drug usage in our country, every year, 2.5 times the number of people that died in Vietnam will die from prescription drug misusage in our country. So you can see it's a highly safe therapy, and we'll get into the effectiveness.
Well, now, exactly what are some of the procedures of application?
Well, medical ozone therapy, medical ozone is a gas, of course. You take oxygen, you energize it with ozone, with, electronic field or a high energy plasma, turns it into ozone. Well, this ozone is still a gas, but it's very energetic. Now, it needs to be used immediately because it will disappear in about half an hour. It'll just disappear. You can't really bottle it or sell it or anything like that. It must be created on-site by the physician. The physician will then either take blood out of someone, let's say they'll take about 500 milliliters out of the body in a vacutainer bottle of blood, then they'll mix ozone in this vacutainer and put the ozone in with the blood. The blood will absorb all the ozone right into it, turn a bright cherry red, beautiful lifelike color. And interestingly enough, people who are sick always have dark blood. Their blood is very dark. It's either very dark brown or almost a dark purple, tending towards a black. Someone who's healthy has a bright color blood. You can see one is closer to death than the other, so he's sick. He's got less life in his body, less oxygen in his body. So when we ozonate the body, by ozonating the blood, what we do is we take that ozonated blood and we then infuse it or drip it back into the arm. This is every doctor I've talked to. This is the majority of the doctors. This is the way most of them do it. They will drip the ozonated blood back into the patient over the course of about half an hour. Other doctors are doing what's called direct IV infusions. What they do is either slowly inject it into a vein in the arm, or they'll put it right into one of the large veins, let's say the subclavian vein in the neck. And that's another way of putting it directly in. That's a more aggressive therapy, but it has to be monitored more closely because it is a more aggressive therapy.
Right, okay. And there are other methods, is that not true?
Yeah, many people, in fact physicians as well, are using what's called rectal insufflation. If you were to go into the hospital and have your lungs operated on, your lungs, of course, would be deflated. And when you lose the pressure in your lungs, you can't breathe anymore. So what doctors do to overcome that during lung surgery is they will take oxygen, just pure medical grade oxygen, and they will run a tube up into someone's colon through the anal opening, and they call this using the colon as a second lung. And they put oxygen into the colon, and since the colon is where we digest our food and it's full of blood vessels that absorb the nutrients and the minerals into the body, by putting oxygen into the colon, what happens is these miles and miles of blood vessels around the colon will absorb all the oxygen, and that way they can operate on the lungs, and the person actually is breathing through his colon, so to speak. Well, the doctors then said, well, why can't we introduce ozone into the body this way? And indeed they can. And so many people are having physicians treat them through the method of rectal insufflation, which is using an insufflation method in the rectum, or going up into the colon with this medical-grade oxygen ozone gas. It's not as efficient as the intravenous methods at all, but it is a way of doing it without using needles at all. So many people in the United States, in fact in the underground, are getting medical ozone machines and then using this to treat themselves, usually under the care of a physician, because of the problems we have in this country with legalities of this.
I see. Now, does this actually rid the body of all signs of the virus?
You're speaking about which disease now?
Well, HIV.
The medical ozone therapy, as I said, is a way of surrounding a virus with oxygen. There are specific protocols where it must be given, for example, every single day for a period of 21 to 30 days. It's very important to do that. So it takes 21 days of continual application every day, getting an infusion or a shot of this, minimum 21 days, to finally flood all the tissues in the body. If there are any viruses in the blood, in the plasma, in the tissues, floating around in the body that are anaerobic, and all the disease-causing microorganisms are anaerobic, for the vast majority, 99% of them are anaerobic, then if they get surrounded by oxygen, as soon as the oxygen hits them, psst, they're burnt up. Their history. It doesn't matter which virus we're talking about. We could talk about the HIV virus, we could talk about the hepatitis virus, the herpes virus that hides in the spine and then breaks out on the skin. All these viruses are anaerobic viruses. In other words, they can't live in oxygen. You surround them with this medical oxygen ozone therapy, they die. It's really that simple. And it's so simple, it confuses the great learneth ones who want to look for some big, complicated thing and spend billions of dollars on machines and research, when this very simple fact of nature is that these viruses cannot live in oxygen. You flood the body with oxygen, people get well. As a journalist, I have interviewed hundreds of people. Hundreds of people.
Hang on. Pause it for a second. See, I think we left it up where, well, why don't I just pick it up to where asking you about how I keep hearing people being converted from HIV positive to seronegative, and then maybe from seronegative to HIV negative, I think. Is that?
It's the same thing.
Oh, it is the same thing. Yeah. Okay. Could you explain exactly what is going on here, what that means?
Okay, so we'll skip to that last. Okay. Medical ozone therapy, I'm a journalist. I've interviewed over 200 doctors, and medical ozone therapy, these doctors, by the way, use it in their clinics. It's not something they wish they could use. These are doctors that have actually used it, some form of oxygen therapies. And these doctors that I have interviewed all tell me it's highly effective. Now, you are probably curious, just, how effective is it on AIDS? Because that's one of the main things we're talking about. Well, first let me preface it with saying that doctors from all over the world have identified 30 or 40 major diseases, including cancer, arthritis, Kaposi sarcoma, emphysema, asthma, many, many diseases, rheumatoid arthritis, flu, colds, the common cold even, that these treatments are highly effective on, because all these diseases have bacteria, viruses, funguses, or pathogens that are associated with them. They're all anaerobic. You flood the body with oxygen, they die. So medical ozone therapy is used in the treatment of AIDS as well. Now, AIDS is defined by the Center for Disease Control in Atlanta, Georgia, our government CDC. They define AIDS-related complex, ARC, as being when someone tests positive for the presence of either the virus or the antibodies to the virus, and they have several disease markers. Let's say they would have Coxsackie virus, or thrush, or candidiasis, or diarrhea, night sweats, fever, swollen lymph nodes, etc., etc. If you have a majority of these markers, you are said to have AIDS at this point in time. So, does the medical oxygen ozone therapies work against all these things? Well, I've got a letter here from a doctor. This is a doctor in Nevada. Brief summary of 4 cases of AIDS treatment with the intravenous ozone therapy. Dear Mr. McCabe, 4 male patients were treated with 2 weeks of daily ozone infusions, each lasting 1 hour. Now, mind you, the best protocols are not what I'm speaking about right now. This is just someone's experimented for 2 weeks with ozone. This is not the major protocol. These patients were also eating fresh foods, taking nutritional supplements, abstaining from recreational drugs, and practicing, quote, safe sex. Patient number 1 had diffuse Kaposi's sarcoma for 9 months. Patient number 2 had chronic diarrhea, chronic cryptosporidium intestinalitis, chronic fatigue, and weight loss. Patient number 3 had chronic fatigue, chronic thrush, and patient number 4 had chronic fatigue. In addition, a 5th patient was treated with an 8-day course of similar therapy who presented with chronic rash, chronic fatigue, and neuroleukodystrophy related to AIDS. Now, the summary of results of these 5 patients, he's given them ozone 1 hour a day for only 2 weeks. Still, at that low dosage, here's the results. We now have a 4-month follow-up. All of the patients are in complete clinical remission, including the patient with Kaposi's sarcoma. This is amazing in itself, let alone did they seroconvert. Well, they didn't seroconvert because they didn't have the therapy long enough. They're not following the most advanced protocols. This was an experiment. The 5th patient with the neuroleukodystrophy is now 50% improved 1 month after treatment. And I'm trying to tell people that this is available to them and trying to get the establishment, so to speak, to incorporate it in our medical practices. My degree is in educational media and technology from the University of Massachusetts. I'm a journalist, and what qualifies me for doing this type of thing, like writing the book and giving these lectures and all, is that I have interviewed thousands of people that have been taking oxygen therapies, which is our subject tonight, and hundreds of doctors that use oxygen therapies daily in their medical practices.
Okay. Just you can keep it here if you want to.
Products that are backing up in our systems. When you give the body enough oxygen, it can finally burn up this toxicity. If you were to blow on your hand, you see that your hand is warm. It's warm and it's wet. We're burning up. This is the process of life. We're like a candle that's trying to burn. But this candle called life can't burn very efficiently unless it has enough oxygen. Well, nobody on this planet has enough oxygen. I mean, we live, we get by, but everybody's getting sick and diseased, aging, dying long before they have to. If the oxygen is returned to the body,
Mr. McCabe, if you could just kind of, give me a little bit about your background and
okay.
What you do for a living and qualifications, things like that.
Well, I'm the author of the book Oxygen Therapies, and up to the present time I've been on about 750 radio and TV shows and speaking platforms trying to get the information out that you're about to hear on this tape, that there is a very highly effective form of medical treatment being practiced around the world, yet it's being completely ignored by the mainstream medical people in the United States and into the body, so that 2 main things happen. The first thing is that all the garbage, the pollution, all the environmental toxicity that has been collected in our bodies since we were young children and even in our parents' bodies before us, all this is making our cells unable to function like they're supposed to. So what happens is the body is trying to remove this waste, but since there is so little actual available oxygen anymore in the atmosphere or in our food or in our water, because we've gotten so far away from nature, that what happens is our bodies are no longer able to remove the pollution, the toxicity, the waste product.
Between you and me here.
Okay.
Just speak to me. Okay, well, let's get right down to it. I mean, could you explain the basis of how oxygen therapies, or should I say ozone therapies, work on diseases like AIDS?
Okay. Well, medical ozone therapy is one of the many oxygen therapies. In my book, Oxygen Therapies, A New Way of Approaching Disease, I have talked about approximately 30 different ways to oxygenate the body, including such simple things as deep breathing. There is a way to introduce very active forms of oxygen